Hi, friends. This is Dr. Ravi Kamepalli. I'm an infectious disease, wound care, and board certified obesity medicine doctor in Georgia. And essentially, I'm going to talk on the topic of metabolic syndrome, which is a real pandemic affecting us. And my website is nobadbugs.com, and you can reach me at Twitter handle at wound physician. And my hashtag for most of my social media posts is hashtag removing barriers to healing. My conflicts of interest are nothing but removing barriers to healing for infections, wounds, and obesity medicine. And I'm working on a telemedicine solution that would hopefully one day help solve these problems that we're facing in healthcare. My task and target in healthcare is to target the tsunami of chronic diseases and helping my patients understand that and improve so that they can prevent the complications that result from the chronic diseases leading to infections and wounds and chronic disease problems that is affecting 75% of healthcare costs. Today's objective is to define metabolic syndrome and identify it, discuss the prevalence, and discuss and understand the causes of metabolic syndrome along with consequences and possible treatment approaches. We can define metabolic syndrome, which is nothing but a cluster of five criteria, which we will go through. And essentially, this criteria has insulin occurring at high levels, secondary to the liver and other organs not able to respond normally, and the pancreas ending up secreting more insulin. And this metabolic syndrome, when it is present, increases the heart disease and stroke by 3 to 5 times than when compared to the normal people. So three of the five criteria here, then when positive, you're able to identify yourself as having metabolic syndrome. Whereas even one of them, when present, is also a problem of insulin resistance. So just because you don't have three and you have one does not mean you do not have insulin resistance. You do have insulin resistance, which is at the root of each of these criteria. The first of this is waist circumference, which is not measured by most human beings. They have a tailor tape at home, or most doctors' offices don't even measure this waist circumference, which is the main criteria that is measured. So, any waist circumference that is 40 inches or more for men, and 35 inches or more for women. And HDL criteria, 40 milligrams per deciliter or less for men, 50 milligrams per deciliter for women, and triglyceride criteria of 150 milligrams per deciliter or more, and blood pressure criteria of 130 over 85, and fasting blood sugar of 100 milligrams per deciliter equal to or more. So three of the five. So even if you have one of them, then you have insulin resistance, and that is something that has to be improved. And simple approach is to eat less starches, grains, sugars, or processed food, and eat more healthy fat and protein, and exercise. Basically, tiring out the muscle and increasing the muscle mass, but also eat less and using fasting techniques that are out there. So why is this very important? As you can see here, in this prevalence study that was done by in National Health and Nutrition Examination Survey that was done from 2009 to 2016, this showed that only 12% of Americans were insulin sensitive. So 88% were metabolically unhealthy. And when it comes to more than 60 years of age, more than 98% of people were metabolically unhealthy. And also another cardiometabolic health survey done after the first survey is showing that the people are only 6.8% cardiometabolically healthy. So by these two criteria, only 6.8% of adults here and also 12% of adults from the previous study are metabolically healthy, whereas the nutrition recommendation for Americans is given for healthy Americans, but unfortunately is being applied to the unhealthy majority of the people. So when it comes to the obesity prevalence, all states, there is increased prevalence when compared to before. And obviously, in the southern states, it's more than 40%. And the prevalence is so dramatic that when compared to past 70 years ago, the diabetes rates was 1%, and now it is 13%. And when compared to the past, now the pre-diabetes and diabetes is combined 50%, and even in children it is 30%. So this is a state of healthcare that we are in, and the state that I am from is ranking 12th in the country, and basically in the age group of 45 to 60%, there are 37% of population that is having obesity. National costs of obesity is around $1.72 trillion, and basically healthcare costs in at individual affected by obesity is 42% or higher. So unless we do something major and understand what are the main causes of metabolic syndrome, we cannot really make that impactful change. The main cause is insulin. So what is insulin? Insulin is a growth hormone, which is a primary driver which we need for survival, without which we will end up having problems. So it is a necessary hormone that we need for growth. So, but the too much of insulin that is stimulated is a problem. So, basically, insulin is needed to convert the extra glucose in the blood in the form of energy into the fat, and it is needed for glucose entry into the cell. But when the problem happens with insulin is when the mitochondria are not able to burn the sugar, and basically the body continues to secrete more insulin to help the mitochondrial function. Because of the mitochondria not functioning well, the insulin levels continue to increase, and the higher the insulin level is one of the first indicators for metabolic dysfunction, almost 10 years ahead before the diagnosis of one of the chronic diseases of diabetes. So the main path to metabolic syndrome is a visceral fat, and that leads to multiple chronic diseases, which we'll discuss. And this fat accumulation in the abdomen is ectopic, that is not where it is supposed to be, and it is mostly in the abdominal area, and basically it is variable. It is not defined by simple BMI criteria, which was initially used for diagnosis of diabetes, but even in thin people, people can have metabolic syndrome. So the poor metabolic health is a consequence of metabolic syndrome that can lead to all these myriad complications of metabolic syndrome, including heart disease, fatty liver, PCOS, muscle loss, which is sarcopenia, migraine headaches, arthritis, dementia, anxiety, depression, obesity, diabetes, and hypertension. Like we discussed earlier, in metabolic syndrome increases the problems of heart disease, stroke, and type 2 diabetes by 3 to 5%, and leads to all the other chronic diseases, including atherosclerosis, retinopathy, neuropathy, nerve pain, foot pain, heart disease, stroke, fatty liver, peripheral vascular disease, diabetic foot ulcers, and heart diseases. Now, it is simple. We have to work up and identify. It is simple to identify. It is first step to identify that is to measure one's waistline, which is 40 inches or more for men, 35 inches or more for women, measured at the level of belly button, and blood pressure 135 over 85, mostly taken at home, and or if they are taking blood pressure medications already, that is a shoe-in criteria, and triglycerides more than 150, and HDL less than 40 in men, and less than 50 in women, and the blood sugar fasting of 100 milligrams per deciliter, or if they are taking diabetes medication, they automatically meet that criteria. Now, how do we go about the treatment approaches is diet and nutrition, which is the first dietary style of living that is very important, and physical activity, 30 minutes or more with with activities that include muscle building. So we'll talk in detail about the diet and nutrition. We'll not talk much about the medication, but as a part of this, we have to discuss about medication that are needed, that are insulin sensitizing medication, including biguanides, SGLT2 inhibitors, and GLP-1 agonists that are used, but also the ACE inhibitors for blood pressure, and statin and non-statin approaches for improvement of the cholesterol criteria is very important. But these need to be closely monitored because statins are also known to cause diabetes. Now, the main approach to nutrition that I promote for my patients is low carb dietary environment and lifestyle, which is kind of endorsed now by major organizations in the country, including American Diabetes Association, which finally is on board with this consensus report in 2019, stating that this low carb approach is demonstrated to have most evidence for improving glycemia, and this when compared to the variety of eating patterns. And American Heart Association in 2022 released a statement saying very low carb diet yields a greater a greater decrease in hemoglobin A1C, more weight loss, and fewer diabetes medication in individuals with diabetes. And Obesity Medicine Association, which I am a part of, is showing that good evidence that even low carb and ketogenic diet help with weight loss, epilepsy, diabetes mellitus, and also improvement in cardio metabolic risk factors, and emerging evidence for acne, PCOS, and also Alzheimer's, and even cancer, brain cancer mostly specifically. But also we can understand that the benefits of low carb diet include a proven improvement in the markers of metabolic syndrome, and this is done by appropriate protein and above ground vegetables, and also healthy fats. This is done by promoting weight loss, which low carb facilitates weight loss, especially targeting the abdominal fat, and also stabilizing blood glucose by improving the insulin sensitivity and improving blood pressure, through which the heart disease and stroke is improved, and also enhanced lipid profiles. Overall lipid profile is remarkably better, and also there is improvement in the HDL cholesterol, quote unquote good cholesterol, but it's depending upon the kind of fat eaten. Also, the HDL cholesterol does improve. And how do I go around this? Is by minimizing insulin resistance. We can do that by eating nutrient dense food that is improving satiety, and also targeting by eating good quality animal protein, and avoiding empty calories, and minimizing glycemic impact with carbs that are protective, and basically avoiding high impact processed insulin stimulating foods, and also eat only foods that in a specific time range, so that you're not continuously snacking, so that the insulin spike does not always happen. So there has to be infrequent meal scheduling, and also that helps deplete the liver glycogen, and also keeps the body in a fasted state. So the best part is to increase the muscle mass that helps mitochondrial health, and specifically the dietary pattern has to be to minimize insulin resistance by using appropriate protein, increasing dietary fiber, eating low glycemic index foods, and lowering unsaturated fat intake, which has omega-6 oils, because the industrial oils can cause problems with easily being oxidized, and avoiding snacking, building muscle mass, and including some meditation and sleep, and also processed food avoidance, and using the intermittent fasting techniques. The key takeaway in this approach is to use remission of chronic diseases, including diabetes. Also happens with the remission of metabolic syndrome criteria, and this dietary lifestyle improves the medications or reduces the use of medications, and educated physician can play a huge role, and using whole foods reduce the chronic diseases. And also patients need to be able to pick appropriate approaches. So we need to include nutrition, but also we have to understand that food addiction is a huge criteria that needs to pay attention to, and come up with a personalized lifestyle for each patient. Metabolic syndrome is the real pandemic for healthcare, and this is it's a pandemic in slow motion that is influencing the outcome of chronic diseases, wounds, and infectious diseases that I deal with. And we have to empower the patients, understanding and diagnosing, and hopefully guiding using different tools, techniques, and processes. We have to understand that every human being is an author of his or her own health and disease. And as Hippocrates in the past said, everyone has a doctor in him. We just have to help it in its work. We have to make them recognize it, and the natural force of healing is within each one of us. And our food should be our medicine. Our medicine should be our food. Please feel free to contact our practice or reach out to us for further instruction and guidance if you need. But please reach out to your doctor, and be a learned patient to make sure that you take ownership of your health and be a part of your overall healthcare improvement journey. Thank you very much, and have a great day.